I'm going to try and just rein it back a little from the social license to Carolyn and I are going to talk about the regulations. So we talked earlier about why riding schools are regulated and other parts of the industry aren't. Livery yards come to mind, and sanctuaries, and that's the way government works. Back in the 60s, and it was that far back, it was considered by society that riding schools were an area of poor equine welfare, and that's why they were targeted. And we're slightly left with that legacy being regulated by government, whereas self-regulation would be much more effective. And as an industry, we tried to rein that back in the noughties. Across the industry, we tried to rein back so we would self-regulate as riding schools and bring the other organisations in. And I'm afraid modern political situation, going right back to the red tape challenge in 2012, 2011, we are stuck with where we are in terms of the licensing. And we're stuck where we are in terms of our government, and as a nation, we get what we deserve. In that respect, the regulations that came in 2018 were due for a 5-year review, and we're still waiting for the results from that. And there is no progress on that from last year. Karen will give us a little bit more update from a legal perspective. I'm here representing us, the ABRS, and B, the Royal College, which is the veterinary aspect of the inspection. So I'm happy to field questions and like this to be interactive in that respect. I'm going to move on. Brilliant. Okay, so this is how it used to be in terms of what we had to display and have in terms of paperwork and so on. And it was all very lovely and tickety-boo under the 1960s and 70s Acts. But things have moved on significantly in terms of paperwork we require for that tick box exercise of the local authority inspection. Here are a few of them. And I'm sure you've all got written policies for all of these. And it is quite a thing to produce, and we have also had to produce them for our local authority inspections for several years now, and presumably they're all tucked away. So I'm just looking at number 2, biosecurity today, because A, I'm a vet, and B, it is becoming more of an issue, and we as society are more aware of biosecurity because of the COVID problems that we had within humans. We now understand epidemiology. We now understand that it's the right SH show in terms of how things work, and we can apply that to some of our equine diseases and how we can make this more practical for our businesses. Okay, so moving down there, biosecurity is everything on this page. Property maintenance is relative to biosecurity. It's relevant to biosecurity, because if we have poor fencing and poor turnout situations or poor management situations, that will lead to injury, and injury is a form of disease. If we have poor diet, we will have a form of disease. If we have poor teeth, we will have a form of disease, and so on. So disease, which is essentially not being normal, and that biosecurity is prevention of that. So if we just move on, George. Okay, so Rowley chairs a group, the Disease Coalition, which is cross industry, includes equine vets, includes epidemiologists, includes people from DEFRA and from the devolved governments. And we came up with this some time ago now. This checklist was very kindly published as a centre spread on posh paper in the middle of the Horse and Hound some 8-9 years ago, but I think it's still really effective in terms of trying to sort of drill down what biosecurity is and how it works. So if you ever need any of that or want a poster of that on your wall, I think it's a good place to start. Okay, do you want to move on, George? Okay, so veterinary medical conditions here, things we need to prevent in our biosecurity. So illness is the obvious one, and we're going to cover that in a reasonable amount of detail shortly. Colic is another, and we talked about management, and we talked about diet, and that's key to that. We talked about injuries already. Lameness is a big thing in horses. Up to 20% of horses are lame at any one time, and it's quite a difficult thing to manage. Is something we have to cope with, and breeding seems to be becoming somewhat inadvertent practice, and it does require control. Okay, do you want to move on? The strangles is Britain's most serious endemic disease. that's the first thing. What is an endemic disease? What is an exotic disease? So strangles is endemic in the UK. It's here to stay, and it is hard to control. Although it has a low mortality, and that varies between 2% and some papers say up to 10% mortality, it does cause a lot of suffering, and it does spread across group, and it can cause phenomenal economic impact to a equine establishment, including a riding school. And it's very difficult to treat. And after an outbreak, there are symptomless carriers which keep it just carrying on. So how do we try and manage that infectious disease? Hopefully, many of you may be, or hopefully not, familiar with the RAG system and the steps to prevent strangles. The red, amber, and green system is how we try and attempt to control a strangles outbreak within our yard. So I'm just using an example. At the moment, in the last 2 weeks, I'm dealing with a strangles outbreak in the yard of 20 horses. And the biggest problem we have with this yard is it has DIYs, it has liveries, and it has a riding school component to that small yard. The biggest problem we have on that yard is space. Now, I mentioned breeding earlier because the reason that it's got into this yard is somebody one of the DIYs sent their mare off for breeding, came back from stud 3 days later, showed strangle symptoms. And in that time, it had been in its stable. So the only in contact were in that barn, the horse immediately in the stable next door, and then serially down the line, covering 3 horses in that barn. There hadn't been any other contact. That was our red group, and we managed to isolate that group. And then we have the amber group, which was some further down the line, were potentially in contact, but several down the line. And then we have the green group, which is the rest of the horses. And that green group have managed to carry on doing what they want to do. The red group, the initial signature cases recovered. And all these horses, all they have is high temperatures, off their food, very dull, depressed, develop a cough, but none have developed abscesses. But all that now, the whole of the amber group have become a red group, and there has then been some discussion whether some of the green group have been in contact with the amber group, and that's where we're at 2 weeks on. And that's the reality of trying to control the endemic disease that is strangles, is that these groups change quite dramatically. You're probably aware that humans can act as vectors, as fomites, and carry strangles from one horse to the other. Strangles is quite interesting because it's a bacteria. It's heavy. It doesn't last long in the environment, but it can survive in water for a few days. But it can be spread on droplets from one horse to another by a person. So in theory, it should be quite easy, or relatively easy, to isolate if one has enough room. And I think it's important to try and think of these things when we come up with our biosecurity policies. So going back to the beginning of the talk, we talked about our biosecurity policy, our preventative health policy for our riding schools, which we wrote 5 years ago. And have we looked at them since? And have we thought about disease outbreak? And have we applied anything we've learned in those 5 years in terms of our experiences in terms of disease to update those documents? We just move on, George. Okay, so there is now a strangles vaccination. Is anybody in the room using this strangles vaccination? No, well, that would be true of all my clients too. It's interesting, but where our industry is at the moment, can we take on more cost? Can we take on the cost of a vaccination that requires 2 doses and subsequent boosters at least every 6 months and more in face of an outbreak? So very few, even private horse owners, are using this vaccination, but it is there, and it can be used if in the face of an outbreak in the green group, and it can be used in the red group to facilitate reducing carrier capability. Just move on, George. Okay, so we're talking about respiratory diseases. We talked about strangles, an endemic disease in the UK, and the one that all these biosecurity policies are written about. But there are other ones. Influenza, we still vaccinate against influenza. If we're in a closed equine population, these diseases, how much will that affect us, and how much should we consider that in our biosecurity protocol? So EHV, Some of you may be aware of an EHV outbreak at Crofton Manor in the southern England. Jodie was talking earlier about centres closing down. That was a BS jumping centre. They had an outbreak of EHV because of horses coming in and competing. Some of those cases were neurological EHV, and they went public with it. They were very open about it. But unfortunately, it led to them having to close down as a competition centre just because of the public attitude to herpes. Now, one can vaccinate against herpes, but as we all know, herpes vaccination isn't the be-all and end-all of disease control, and it's quite complicated. There are other viral diseases out there, and the UK, particularly exotic diseases, UK that is under threat from. One of the worst ones to think about would be African horse sickness. Now, we don't think very much about African horse sickness, but it is a very high risk disease. It's low likelihood, but it is high risk. Having said that, blue tongue, which is currently in sheep in the UK, down in Kent and so on, the vectors, the midges have blown across from the near continent, from Belgium and so on, is exactly the same type of virus, or the same family of viruses as African horse sickness. So the same vectors, it's the same disease situation. The difference is with horses is that African horse sickness has 95% mortality. So if it did get here, it would be very concerning. And it does come in in theory, comes in around airports. It can come in on aircraft from sub-Saharan Africa. The vectors come in, and all you need is a few signature cases near an airport, and then you have an outbreak. And the DEFRA's policy on the AHS outbreak is somewhat draconian and scary. Involves slaughter policies, 3 kilometre slaughter policy around a case and so on. And there is a chance that might come into the UK. So viral diseases, that kind of diseases are out there. Zoonoses, on our biosecurity protocol, zoonoses are really important and they should be on there. We're quite lucky in horses. We don't actually have that many zoonoses. We're phenomenally lucky. Ringworm, which hopefully you're all familiar with in terms of prevention, in terms of observing, in terms of your human resource management, in terms of your employees, really important, and the public. And immunodeficient people are really vulnerable to ringworms, and that's worth bearing in mind. Salmonella is always mentioned in horses. Pretty rare, I'd have to say, as an equine practitioner in 30 years. I've seen a few suspect cases, but I've never seen a proven case. Okay, move on, George. Okay, so this biosecurity, overriding biosecurity policy of an establishment that they produce for their local authority. It's very in-depth. It's 3 pages long. I wondered, how in-depth your biosecurity policies are, and whether you've taken all these things into account. Particularly quarantine on a new arrival, which is the mental state of the horses in terms of trying to implement their health and freedoms. And it's really tricky, quarantine and new horse arrival policies, how to meet the mental health of that new arrival in their new environment. Biosecurity is also important. Here on their quarantine policy, they've got 21 days. That health checklist that you saw earlier is 14 days, and some organisations reckon 4 weeks. You just have to think about the mental impact of that as well. Next page, George. So what do you do in the event of an outbreak? There's our red, orange, and green group. Think about how that applies to your establishment. How are you going to implement that? I think that's really important because there's so much headless chicken behaviour when there is a suspect case on any type of yard, be that a riding school or otherwise. Just thinking about how we're going to manage our equine population for resources and facilities we have into red, orange, and green group is really useful. Next page, George. Worming programs, don't know where you got to in worming programs, but worming or parasite control is really important part of our biosecurity. And this still involves a chemical worm. So you could argue this is a slightly outdated one, but it's a relatively one. There's only one definite worming use of chemical wormer in this. It is an equine framework, so the animal has to stay indoors ideally for 2 days, prevent the environmental contamination of the ivermectins involved that affects insects and wildlife in the environment. But otherwise, this is a worm egg count based policy. So this is a good place to start if you're following a purely chemical worming strategy at the moment. And also, when we always think about parasite control, that also includes this ectoparasite control, and that's somewhat overlooked in this country. But with increasing changes in the environment, control of ectoparasites and disease vectors has to come into play, and fly control is so important. Okay, next slide. Page 3, there we go, cleansing regime, introducing a new health policy. This is quite a good one, but it one does worry about the mental health of the new horse, but it's important if you are getting new horses in regularly that you do have to consider they can bring in that disease we talked about earlier, strangles. Next page. And that's it. Everything we do is a preventative healthcare. Thanks very much. We're rushing on because we want to have some good social time at lunch, and because that's what we're all here for.